Hi, I'm Dr. Jeff Dolgus from Buffalo TMJ, and I've been thinking I need to make a video like this for quite a while now, but I've been kind of hesitant because I don't really want to get censored for asking legitimate questions and pointing out some of my observations about how masks seem to be affecting people who have TMJ dysfunction. But honestly, I never in a million years thought people would still be wearing masks in public almost 2 years into this global health scare. But last week I had another patient come in who said that wearing masks all the time is really irritating her jaw. So I figure it's about time I weigh in on this topic. I would estimate that over the course of the last 2 years, during which time mask wearing has increased tremendously in the general population, the number of patients complaining of ear symptoms in my practice has at least doubled. I know for myself, if I have to wear an ear loop surgical mask for an entire day, my ears start to become very sore within just a couple hours. Some of the more common ear symptoms people with TMJ dysfunction will report are fullness or pressure in the ears, ringing is very common, and of course there's ear pain. And I can tell you that ear symptoms are the toughest symptoms to figure out and resolve using therapeutic approaches for TMJ dysfunction. I think sometimes these things are related, but I don't think there's usually a direct cause and effect relationship between TMJ dysfunction and ear symptoms. But I have to acknowledge the fact that ear symptoms seem to have increased significantly since people started wearing masks all the time, and I think there could be a relationship here. Now, when you have ear symptoms, first I think it's important to test out the theory that your TMJ dysfunction is somehow related to those symptoms. And there are two primary ways you could do this. First, open wide and close. Then clench your teeth together and then swallow. Move your jaw side to side and then forward and back. Did any of these activities change the symptoms you're experiencing in your ears? If there's ringing, did it make the ringing louder? Did it make the ringing softer? Did it change the pitch? If there's ear pain, did these activities make the pain worse? Or maybe do they make it better? If you do these activities and you notice a difference in your ear symptoms, then it's probably a good bet there's a connection between your TMJ dysfunction and your ear symptoms. But if nothing changes, then they're probably not linked. Another way to determine if there's a connection here is to recognize how you feel after you eat a meal. Do your ear symptoms change after eating? Sometimes there can be a delay here, and people will frequently report that their ear symptoms intensify about a half hour after eating. And this is a strong indication that there may be a close connection between the function of your jaw, particularly the muscles, and your ear symptoms. In either of these two instances, there's a good chance that if you engage in some form of TMJ therapy, you'll be able to reduce your ear symptoms. But figuring out if your symptoms relate to mask wearing is a different story altogether. First, you should just ask yourself if you notice that your ear symptoms intensify when you have to wear a mask for an extended period of time. And if you take a break and allow your face to be free for a few hours, do you notice that your symptoms are reduced? Now, if you do suspect there's a connection here, what can you do about it? Well, the first thing I would suggest is that if you don't have to wear a mask, don't wear one. It goes without saying that fresh air and sunshine are very beneficial to the human body and are critical to support a healthy and robust immune system. So if you can minimize the situations where you would feel it's necessary to cover your mouth and nose, you can maybe reduce the amount of time these devices will be pulling on your ears. And I should point out here that as a dentist, I wear a mask all the time, but it's not because I believe it prevents me from getting sick or inhaling some contagious airborne pathogen. I wear a mask mostly because I don't want people's spit and blood and plaque getting into my mouth, because that's kind of gross. I remember when I was in dental school not wearing a mask one time when I was cleaning a patient's teeth, and I flicked a chunk of tartar right up into my mouth, and it was kind of gross. After that, I wore a mask whenever I was working on people's teeth. Now, I also wear a mask because I don't want my saliva getting into a patient's mouth, especially when they're propped open and they can't really do anything about it. And despite the effectiveness of the expression, say it, don't spray it, I want the news, not the weather, we all spray a little bit when we speak. So the questions I think we have to answer here are, number one, is the stuff that's coming out of my mouth, meaning the air and the particles and the droplets, dangerous to other people? Are there any scientific studies which demonstrate that diseases can be transmitted from one person to another through exhalation, or speech? Number 2, is public mask wearing by a general population an effective method to slow or stop the spread of viral type illnesses? And what scientific studies are available to support this theory? And number 3, are there any detrimental effects to wearing masks all day, every day? So to answer the first question, I searched for any randomized controlled studies showing that a disease was effectively transmitted from one person to another via close proximity and exhaled air. And to this day, I haven't been able to find a single study that shows this. I was able to find several studies which were conducted by the U.S. Public Health Service beginning in 1917, right around the time of the Spanish flu. And they were published by the American Medical Association, I believe, in which the researchers not only tried to get the Spanish flu to be passed through close proximity to symptomatic patients, breathing and coughing on healthy volunteers, but they also took nasal and throat swabs from the sick people and inoculated the noses and throats of healthy volunteers. Not one person got sick. These studies are summed up in detail in Arthur Firstenberg's book, The Invisible Rainbow. So I think maybe we should all take a step back and reevaluate our assumptions about what causes diseases and how they're transmitted. Now, to answer question number 2, I searched for studies on public mask wearing and was able to find quite a few. After reading through several individual studies and also a few meta-analyses where researchers looked at and compared lots of studies, I realized that none of them showed conclusively that public mask wearing made any difference at all in the spread of viral type illnesses, most of them specifically studying influenza. But there was one recent public mask study which was done in Denmark last year, and it looked at the effectiveness of mask wearing related directly to COVID-19. This was a pretty big study with about 6,000 participants, and it was controlled, meaning that about half of the participants did not wear a mask in public, while the other half did. What they found was a negligible difference in infection rate between the masked versus the unmasked, with 1.8 of the masked people coming down with the illness verified by antibody testing and PCR, while 2.1% of the unmasked group were positive. This is a far cry from conclusive evidence that masks are effective, and it corroborates previous studies related to masks and influenza. Now, in terms of answering question number 3, do masks do any harm? I looked for any research examining patients for detrimental effects of covering their nose and mouth. Many of these measured blood oxygen concentration using a pulse oximeter, and most studies do not show any significant difference in this measurable parameter. So the scientific evidence to support the theory that masks are harmful is also pretty weak. But in this case, you also have the opportunity to use your own personal experience, which is, in my opinion, a very strong form of supporting evidence. And you can decide for yourself if you feel that wearing a mask all the time is harmful to your health. Now, we have to be careful about the mental and emotional influences here, so you want to be as calm and objective as you can when trying to determine if you feel different when you wear a mask. But if you do feel different or you feel wearing a mask is detrimental, then be confident about that conclusion and don't let anyone gaslight you and tell you how you feel isn't important. While I agree that how a person feels is not scientific evidence, I strongly disagree with ignoring your subjective experience. How you feel is indeed an important part of the overall picture and should always be taken into consideration. So the last thing I want to add here is that there are different types of masks out there. And if you really want to isolate the variable of direct pressure on the ears from these masks, then you could purchase or make masks that do not contact the ears at all and see if this makes a difference. I have 2 types of masks here that do not utilize the ear loop as the retentive mechanism. This type of surgical mask has ties, which are a little bit more difficult and time-consuming if you want to be able to put it on and remove your mask frequently. But if you're having to wear it for an extended period of time, this can help take the pressure off the ears, and this is the style that I prefer if I'm doing a long surgical procedure. And the way these work, you put it over your nose, and first you tie the top. And you could tie it as tight or as loose as you feel like you need to. And then you could bring it down and tie the bottom. And this part goes around your neck. So you can see how cumbersome it can be and how difficult it would be if you had to do this all the time. But once you get this tied, you can always take off part over your head like this and let it hang down if you don't need to wear it, and just sort of slip it back up over the head whenever you need to wear the mask. Now if you have these down too far, it'll still be contacting the ears, so you have to be careful where you're going to tie it and where you're going to allow this to hold which part of your head so it doesn't contact your ears. Now this other type of mask, it's kind of like the ear loop style, but it has two loops on the back, two elastics on the back, and so one will go above your ears and one below. So when you put this type of mask on, you've got one strap down here, just like the ties, one strap on the neck and one strap up on the head, and now I can get a pretty darn good seal with this type of mask. So as it relates to masks being effective, these two styles I think may have a little bit more effectiveness than the more common ear loop style. So I hope you found this information helpful, and if you like these videos and you want to see more, please hit like and subscribe and share my channel with your friends and colleagues. I'm Dr. Jeff Dolgus, and I thank you for watching.